Hi, I'm Karen Brown. I'm a patient here at Mayo Clinic in Arizona. I was diagnosed with breast cancer in February of 2011, and since that time have had surgery, 4 months of chemotherapy, and now I am 2/3 of the way through with radiation. My treatment began when I met Dr. Richard Gray, who was the surgical oncologist who performed my surgery. And I had a wonderful experience with Dr. Gray because he was so good at keeping me informed and letting me know what all the options were. In fact, he even drew a decision tree for me, which as a project management professor, I loved. And he's always been there when I needed him to answer questions when I had concerns as things have gone along. The next step in the process was chemotherapy, and Dr. Donald Northfeld was has been and still is my medical oncologist, and he has also been very informative and helpful along the way. I feel as if I know what's going on, I know what to expect based on the information that he and his staff have provided to me. And then the third phase has been radiation oncology, and there I feel that I'm very well taken care of in the capable hands of Dr. William Wong, who again has not only demonstrated to me that he's one genius of a guy, but he also is very caring and again provides me with information about the risks and what to expect from my treatment and beyond. So I've been very appreciative of the quality of the care I've received here at Mayo Clinic. When I received my diagnosis in February of 2011, it was a real shocker. I just didn't expect that this would happen to me at what I consider to be the young age of 62. I have always taken good care of myself, exercised fanatically, eaten well, eaten all the right foods, and really just generally paid attention to my health. But here I was, and I thought, well, I could either wallow in this or I could take action. And because I teach project management and write about project management, it seemed to me that I had the perfect set of tools and the perfect perspective for marching ahead with this treatment. So I began to think about, well, what's the first thing you have to have if you're going to run a project? And that is you have to have a project manager. And guess what? That's you. You have to be the project manager. Sure, you've got lots of support here at Mayo Clinic or wherever you're having your treatment, but somebody has to be juggling the whole thing. There's more to it than just the treatment. So you need to take charge. And if you don't feel you can take charge, you need to find a family member or friend who can serve as your advocate, somebody who is managing and juggling the whole thing. Then let's think about what are some key issues that project managers do. Well, they set milestones and celebrate them when they have achieved them. They make sure they pay attention to their stakeholders. That's your friends, your family, your circle of friends. Communicate with them, both sending them information, but also listening to them. Because after all, they're still your friends and they still have their own needs as well. Think about the risks. Now certainly you don't want to just get mired in the risks, but know what they are and be prepared for them. This is not a risk-free project. Remember too that this is not the only project in what project management terminology we would call a project portfolio. You have many other things going on in your life. This is time to take stock and think about which of those things you want to continue through your treatment because they're really important in the way they define you and make you feel good. Maybe there are some things you're going to let go of. They weren't all that important and they stressed you out a lot. Let's get rid of those, and maybe there are some new things you want to take on. So those are just a few thoughts on how you could apply project management terminology and more importantly concepts during your cancer treatment. I hope you found it helpful.